Most of us are pretty good about making sure we know the warning signs of disease and things we can do to prevent it, but there is one issue most of us tend to overlook, and we need to get a better understanding of the warning signs and the causes. And in order to do that, all you need to do is open your mouth. Joining us this morning is the Chief Dental Officer for Delta Dental of Massachusetts, Dr. Doyle Williams. And Dr. Williams, great to see you again. What we're getting at here, this is Oral Cancer Awareness Month. Let's start with this. How common is oral cancer?
Oral cancer is about 35,000 new diagnoses every year, so about 110 people every day.
Most people equate this with the use of smokeless tobacco, which obviously is true, but are there other causes?
There are. So alcohol and tobacco are the two leading causes, and many dentists think those are the only causes. But over the last several years, we've found more and more young people getting oral cancer, and it seems to be somehow related to the HPV virus.
No kidding.
Yes.
Oh, so it's interesting, and I don't think anybody would put those two together.
So it's now suggested that both boys and girls ages 9 to 26 get the HPV vaccine.
Now, it's my understanding that most oral cancers are diagnosed late. Why is that?
You know, they're hard to see. They're under your tongue. We talk about the oral cancer exam where your dentist should take a piece of gauze, grab the end of your tongue, pull it out, and twist it so we can see underneath. These are usually not painful lesions. They're just small and overlooked.
And in order to get it done, it's a pretty simple procedure for your dentist to check that. And it should be part of sort of your dental routine when you go in for a cleaning or something like that, right?
That is correct. It's part of the evaluation of every patient and should be done by your dentist. So if your dentist isn't doing it, ask them to do it.
If you are not one who goes to the dentist a lot, or maybe you're in between cleaning, shall we say, what types of warning signs should you be looking for on your own?
So if you've got a hard lump that persists for more than 2 weeks and doesn't go away, that's a warning sign. If we've got lesions that change color, so something inside your mouth or a sore, and it doesn't go away in 2 weeks, it's something we should be weary of. And then people who smoke, if they'll look at their lip, a lot of times they'll have a sunken part on their lip, and this is very often the first signs of cancer.
Is the fact that and the survival rate for oral cancer surprisingly low? I would think most people say, well, you catch that, your chances of survival are pretty good, but that's not the case, is it?
That's not the case. So the people that we're finding very young and finding the diagnosis early have a very high survival rate. But the people that have it under their tongue and the smokers for a lifetime, we find it very late in life. So combined, it's only about a 55% survival rate.
One of the things you find with the young men in particular, at least in my observations, is the chewless, or should I say the smokeless tobacco where they put in. How can you get people to understand the dangers of that? Because a lot of kids, I think, are just using it and they think it's cool and everybody's doing it, and they don't understand there could be a dire consequence here.
There certainly could. In fact, your mouth is the most vascular part of your whole body. So to put that tobacco right in contact with the mucosa, you're putting it right into your bloodstream. So all of the problems that can create are just enhanced inside the mouth. And
if anyone's ever seen pictures of someone who's had the oral cancer, especially coming from the smokeless tobacco, I mean, it's pretty heinous stuff.
It is. The surgery, you know, they resect part of your face, your throat, everything. It is very debilitating surgery.
And what's the one thing with Oral Cancer Awareness Month here you hope people take away? Just know that it exists?
Know that it exists, and make sure your dentist is checking for it. You know, you and I are both fans of the Three Stooges.
Yes, you know that.
I think of Moe sometimes grabbing Curly's tongue and pulling it out. That ought to be the oral cancer poster.
That's right. Hey, Moe, stick out your tongue and get it checked out. It's a very simple thing to do. You go to the dentist, he looks in there, and everything's okay, and you can move on. But if there's a problem, you got to catch it early. No question about it. Dr. Williams, thank you. As always, great to see you, my friend.
Thank you very much.